Sinusitis medications. 5 over-the-counter options for sinus infections. Does the pain and pressure from sinusitis, sinus infection, have you feeling drained and searching for relief? You're not alone. Every year, people in the U.S. spend more than $1 billion on over-the-counter, OTC, sinusitis medications in hopes of easing their symptoms. With so many options available, it can be difficult to know which ones actually help. This guide will walk you through the most effective OTC sinusitis medications, how they work, and what to keep in mind before using them. Can sinusitis be treated with over-the-counter medications? OTC medications cannot cure sinusitis, but they can significantly relieve symptoms and make you more comfortable while your body recovers. Think of them as tools to manage the discomfort, like using an umbrella in the rain. They won't stop the storm, but they'll help you get through it. Sinusitis develops when the air-filled pockets inside your sinuses, located near your nose and eyes, become swollen and filled with fluid. This buildup can sometimes lead to infection. Most sinus infections are caused by viruses and resolve without antibiotics. In some cases, bacteria are the culprit, requiring prescription treatment. Allergies can also trigger sinusitis, which is not an infection at all. That's why it's important to check with your healthcare provider if symptoms worsen or don't improve. Common symptoms of sinusitis include facial pain or pressure, headache, stuffy or runny nose, postnasal drip, mucus dripping down the throat, sore throat, cough. Sinusitis medications. 5 over-the-counter options for sinus infections. Here are 5 OTC treatment options that can help relieve sinusitis symptoms. 1. Pain relievers. OTC pain relievers can reduce headaches and facial pain linked to sinus infections. Options include acetaminophen, Tylenol, ibuprofen, Advil, Motrin, naproxen, Aleve. It's important to take only one type of pain reliever at a time and to follow dosing instructions carefully. Taking more than the recommended dose can cause serious side effects. Certain health conditions and medications may interact with pain relievers, so consult a healthcare professional before use. For example, people with high blood pressure or those taking blood thinners may need to avoid certain pain medications. 2. Neti pots and saline nasal washes. Neti pots and saline nasal rinses are a medication-free way to ease sinusitis symptoms. They work by flushing out mucus and allergens from your nasal passages, helping you breathe more comfortably. When prepared and used correctly, saline nasal washes are both safe and effective. Be sure to follow directions carefully, especially if you're mixing saline at home. Always use distilled or sterile water. If you prefer tap water, boil it for 3 to 5 minutes and allow it to cool until lukewarm before use. This prevents contamination and keeps the rinse safe. 3. Steroid nasal sprays. Corticosteroid nasal sprays reduce inflammation and swelling inside the nasal passages, directly targeting 2 of the most bothersome sinusitis symptoms, congestion and facial pain. Common OTC options include fluticasone, Flonase, triamcinolone, Nasacort. These sprays are typically used once daily and can be safe for long-term use under medical guidance. Side effects are uncommon and generally mild, such as nosebleeds, nasal irritation, or headaches. Keep in mind that steroid sprays must be used consistently to work, and it may take a few days before you feel the full benefit. 4. Decongestant nasal sprays. Decongestant nasal sprays work by shrinking swollen blood vessels in your nasal passages, which provides quick relief from congestion. Popular options include oxymetazoline Afrin, phenylephrine neosynephrine. These sprays act fast, but they should only be used short-term, ideally no more than 3 to 5 days. Prolonged use can lead to rebound congestion, where nasal swelling returns and often worsens once you stop the spray. For this reason, decongestant sprays are best reserved for short-term relief, not long-term management. 5. Oral decongestants. Oral decongestants work in a similar way to nasal sprays by narrowing blood vessels in the nasal passages, reducing swelling and making it easier to breathe. The most common option is pseudoephedrine, Sudafed. Unlike other OTC medications, pseudoephedrine is kept behind the pharmacy counter. You'll need to show identification to purchase it, and purchase limits apply. While effective, oral decongestants can cause side effects such as nervousness, headache, or difficulty sleeping. They may also temporarily raise blood pressure and heart rate. Because of this, they are generally not recommended for longer than 7 days without medical advice. Avoid oral decongestants if you have certain health conditions, including high blood pressure, heart disease, glaucoma, prostate problems, overactive thyroid, diabetes. Important note, oral phenylephrine, Sudafed PE, once marketed as a substitute for pseudoephedrine, is no longer considered effective for nasal congestion. While it isn't harmful, it likely won't help your symptoms. Which OTC medications don't help with sinus infection symptoms? Not all over-the-counter products are useful when managing sinusitis. Some are commonly purchased but provide little to no benefit, and in some cases they may even make symptoms worse. Antihistamines. Antihistamines such as fexofenadine, Allegra, diphenhydramine, Benadryl, loratadine, Claritin, and cetirizine, Zyrtec, are not usually recommended for sinus infections unless allergies are also a factor. While they can reduce allergy-related symptoms, they may worsen congestion by drying and thickening mucus in the sinuses. Always check with a healthcare professional before using them for sinusitis. Mucinex, guaifenesin. Mucinex, guaifenesin, is an expectorant that helps thin mucus in the chest, making it easier to cough up. However, it is not effective at relieving nasal congestion or breaking up sinus mucus. There's no strong evidence that it improves sinus infection symptoms. Combination products. Cold and flu combination products may seem convenient, but they often mix several active ingredients, sometimes more than you need. Many contain antihistamines or guaifenesin, which may not help sinusitis and could worsen symptoms. Examples include Theraflu products, often containing an antihistamine, Mucinex Fastmax products, commonly with guaifenesin and sometimes antihistamines, NyQuil products, usually with antihistamines, sometimes with guaifenesin, Tylenol cold and flu products, often containing both antihistamines and guaifenesin. Read labels carefully to avoid taking unnecessary ingredients. Medication-free options and home remedies for sinusitis. In addition to OTC medications, simple non-drug remedies may provide relief. Saline nasal sprays. Safe for daily use. These help loosen mucus and soothe nasal passages. Bioelectronic sinus devices. Gentle vibration devices applied to the face can reduce pain and congestion. Steam and humidifiers. Moist air helps loosen mucus. Try warm showers, vaporizers, or sipping hot tea. Avoid steam from boiling water to prevent burns. Warm compresses. Applying a warm compress to the nose and forehead can ease sinus pressure. Sleeping position. Elevating your head on pillows may reduce nighttime congestion. Adhesive breathing strips. Products like Breathe Right strips can widen nostrils and improve airflow. Rest and hydration. Extra sleep and fluids support your body's natural healing process. When to see a healthcare professional. Seek medical advice if your symptoms improve but worsen again within 10 days. Symptoms don't improve after 7 to 10 days. You've had a fever for more than 3 to 4 days. You've had 3 or more sinus infections within 6 months. These may signal a bacterial infection or another underlying condition that requires prescription treatment. In some cases, illnesses such as COVID-19 can mimic sinus infection symptoms, making professional evaluation important. Frequently asked questions. Is a Z-Pak good for a sinus infection? Usually not. Most sinus infections are viral, and antibiotics like azithromycin, Z-Pak, only treat bacterial infections. What foods should you avoid with sinusitis? Foods that trigger inflammation, such as highly processed foods, fried foods, and excessive dairy, may worsen sinus pressure for some people. Does Vicks help with a sinus infection? Vicks VapoRub doesn't treat sinus infections, but inhaling its menthol vapors may temporarily help you feel like you're breathing more easily. The bottom line, most sinus infections resolve on their own, but OTC medications can provide meaningful relief while your body recovers. Pain relievers help with sinus pressure and headaches. Saline rinses clear mucus. Steroid nasal sprays and decongestants ease swelling in the nasal passages. Used correctly, these treatments can make sinusitis far more manageable. If your symptoms are severe, persistent, or recurring, consult your healthcare provider for further evaluation and treatment. For more trusted, science-backed health information, subscribe to HeInfo, your all-in-one destination for accurate guidance on medications, remedies, and wellness.